Hi, good evening everyone. Can you please give me a thumbs up if the audio and video is fine? Just give me a quick thumbs up if the audio and video is fine. Good evening, Grishma. Good evening, Ira. Good evening, Pratiksha. Devashish, good evening. Ross, Dhanush, Ritika, Rajni, good evening. Yeah, Ira, I know that you are anxious, and that is the reason that I am taking up this particular session. So just give me a quick thumbs up if the audio and video is fine. And before I start, a big apology for the students who have asked for an individual one-to-one session. I have tried my level best, honestly speaking, but I could not complete all the request that I have got from the student. But one interesting aspect that I saw was that it was almost a common request if I'm gonna show the request to you. So I thought that let me compiled a complete session for all of you so that I can take up all the doubts that you have. Alright, so now let us take up these doubts for all of you. Now before I go forward, please remember it is about the last week of NEET exam. Do you know one thing that is happening? We are at 16th June 2024. We are at Sunday evening. One thing that is happening is after 1.5 years, next Sunday, this evening, this stress will be over. This stress will definitely be over, and that is the best thing that I am waiting for the next Sunday. This stress of preparing for the exam will be over. So let us pull yourself for the one more week, that the next Sunday evening you will not have a stress that you have to study again, right? And let us utilize this 1 week in a way so that we are not supposed to read again. And that is my simple philosophy. All right, now is the last week important? A lot of time people ask me this, ki sir, don't you think that it is the hard work of 5 years of MBBS or 6 months of the preparation or the 9 months of the preparation that is important? Definitely, there is no doubt about it. But do you know, actually speaking, all that you are doing is to consolidate your material in this time. All right, so before I go forward, please see this. That's what I always believe in. More number of topic, more close to the exam you can read, better will be your rank. More number of topic, more close to the exam you can read, better will be your rank. How will be doing that? That I will be talking about in this. Alright. Focus on forgettables. This is not a time to build up concepts. This is a time to memorize. This is a time to remember what you have already read. If you are forgetting something, this is a time, because what I do not want in the exam कि यार मैंने पढ़ा तो था मैं भूल गया. What should happen in the exam? मैंने पढ़ा था, मुझे याद है. मैंने ये पढ़ा था, I have read this, now I can recall this. And that is the philosophy with which we have to go in the exam. Alright. Will you remember everything? Answer is no. You will not remember everything. You will forget it. It is absolutely okay that if you are forgetting certain things. But what is not okay, that you are forgetting everything. So last 7 days, we will have to focus on forgettables. Alright. Third point. More forgettable subject, more close to the exam you should read it, because you have to vomit it out in the exam. It's as simple as that. And what you can vomit? The thing that you have eaten a day before. You can't vomit something that you have eaten 7 days before the exam. So more forgettable a subject is, you have to revise more close to the exam. And next, it's all about theory in the last 7 days. No GTs. No rank-based test. If you honestly asked me, I will say no MCQs. But if you have not covered previous year MCQs, that is something that you should cover. But if you have already done the previous year MCQs 2-3 times in the past, then the last 7 days are about theory, are not about MCQs. So these are the some general tips before I go forward. Alright, some general tips. Now, resource you might have at this stage. You might have consolidated notes that you have created on your own by joining any institute, by joining us, or by joining any other institute. You have created a 20th notebook for yourself. Or you have an annotated TND notes, or you have one shot program, or you have any other short course program, or you have rapid revision or revision express. If you have any other resource apart from this, please let me know. I'm going to add it into the list. But I believe that these are the broad resources that you might be having at this stage. Can anybody tell me any other resource that you have apart from that? Yes? And these are the broad resources that you might be having. And do you know, I have written them in the decreasing order of preference. Whatever that you have to utilize that resource in the last 7 days. Alright, I'm just waiting if I'm missing any specific resource that you have apart from these 5 or maybe these 6. Another resource that you might be having is an LMRP book or a Sure Success book or any other revision book. And that is another aspect that you might have. Alright, yeah. So one shot plus I'm gonna add vibe over here. Alright, okay. Anything else? Alright, I'm gonna add DVT here, right? Any other? So any other short course, I have written it over here because there are many other short course which I might not be aware of. I am telling you, after a lot of months, I have sat down and prepared so much for a particular session myself. So don't worry, I have an answer for each of every query that you have. But give me some time, some patience. I have worked a lot on this particular session because I believe that this 1 week you can have a significant improvement if you work judiciously in this 1 week. Alright, so that is what I wanted. Med Synapse, but I do not know what it is. Yeah, so short, let's put it as a short course, right? Anything else? Alright, so maybe if there is any other short program, let's put it over here, right? Okay, now what are the common issues that I have come across? These are the more issues apart from the academics that I have come across, which I have written. The first is anxiety, stress, self-doubt. Second, how to reduce negatives. Third, how to improve recalls. Fourth, time management in the exam. Fifth, overthinking in the exam. And sixth, FOMO. Is there any other issue that you have? All the doubts that I have got were exactly based on this. Any other issue apart from this? I'm just trying that what are the points that I have to cover in this session. Anxiety, stress, self-doubt, how to reduce negative, how to improve recall, time management in the exam, overthinking in the exam, and FOMO. These are the broad issues that I have come across from the entire list that student have shared it with me. Okay, we're gonna go one by one with each, but if you have anything else, I'm gonna add into this. Okay, chalo. Now let us work on this. So let's go to the first part. So देखो, we have to do a reverse counting. 23rd June is NEET exam. I have told you the first thing is that please make sure that whatever that you have to study, you have studied. Now you should able to utilize this effectively. If it's a forgettable thing, now tell me what are the subjects that you commonly forget? If you say that, sir, medicine and surgery, no. Medicine and surgery are concept building subjects. You don't forget them very, very easily. But what are the common subjects that you forget? Subjects like biochemistry, subject like anatomy, subject like pharmacology. So first we have to list them down that what are the subjects that we're gonna forget. So 23rd June and 16th June, let me do one thing. Let me add a list for you over here. And what I am gonna do is, now I am gonna broadly divide my days into this system. And you want to do it with a different system, you can do that also. But now what I have done is 23rd से reverse counting शुरू कर दिया. आज क्या है, 16th night है. तो 22nd, 21st, 20th, 19th, 18th and 17th. Now my most forgettable subjects are anatomy, biochemistry and pharmacology. These are the most forgettable subjects. So I will do them on 22nd June. Then less than that are micro, PSM, pediatric forensic medicine, and that I'm gonna do after that. Then 20th June is patho, physio, ENT, ophthal, ortho, radio. Obs and gynae on 19th, surgery and anesthesia on 18th June, and medicine, derma and psychiatry on 17th June. Now, one day has to be given to this. More number of topic, more close to the exam, you can revise, better will be your rank. Now, how you gonna do that? Please remember, it is all theory, no MCQs. Only those MCQs that you are repeatedly doing wrong, either as a PYQ or either as a bookmark question, should be done in the last 7 days. Do not give any test at this stage. If you have given so many tests, anyway you don't need a test. If you have not given any test till now, then there is no point giving a test in the last 7 days now. So no test now. It's all about theory. Now how you gonna use a theory? For them, I have written this. The best way to revise is if you have consolidated notes. If you have created your own consolidated notes, this is the best way to revise. You will be able to revise what I have written on this matter. Trust me guys, you will thank me after the exam if you have this and you are doing it in the exam. If you do not have it, there could be a chance that you do not have it, then do you have this? Yes, if you have written a GT today, it was your last GT, this is absolutely fine. If you do not have this, if you have this, don't look at any other resource, just look at this resource. Trust me, you will definitely thank me after the exam. But there could be a chance that you do not have it. Can you still utilize this time effectively? Answer is yes. Then this is the second resource that you should have. Do you have annotated TND notes from anywhere? It's not necessary. Right now, please remember, I'm not talking about that whether you have a DBMCI TND notes or not. I'm not here for that. If you have an annotated TND notes, then that is the second best resource that you have for the last 7 days. Now, if you have it, don't look at any other resource. I don't have it. Then look at this, whether you have it or not. This will be very useful because it can help you in revising all the important topics in the given amount of time. I do not have more than 4 hours to read a specific subject, sometime even less than that. And then, if you do not have it, do you have this? Now the biggest challenge, sir, I have multiple. I have 1, I have 2, I have 3, I have 4. Then follow this priority order. If you do not have this, do you have rapid revision or revision express that you can consolidate? And if you do not have this, then do you have this, this or this? Now these are the resources according to me in the decreasing order of preference that you have to do. If you have this, this is ideal. But a lot of time my experience says that not everybody is able to consolidate them, and if you are unable to do that, then you might need to take help from other resource. Please remember, 7 days key is revision, and revision means revisit. What are you revisiting? Something that you have read before, and more number of topics that you can revisit, better will be your rank. Now, sir, what are the topics that you have to read? There is no limit onto the number of topics that you can read, but I can tell you that these are the 100 topics that I have identified, and I believe that these are the must that you have to have. You need to have. I believe if you ask me out of these 100, how many will be there in the paper? I believe that these 100 are not just important for the NEET PG, they're important for any exam, be it FMG, be it INI CT, and these you have to know. Out of these 100, I will say, if not less, if I give you a conservative figure, I will say 70 to 80 is gonna be there in the paper. Decurvin, stenosynovitis, Salter Harris classification, bone tumors, named fracture, splint names, schizophrenia. Basically, I have written 5 topics from each subject. Schizophrenia, hallucination, eating disorder, alcohol withdrawal syndrome, ADHD, radiation, radiotherapy, contrast, barium studies, IVP, MCU, RGU. I'm going to share this list with you, but I'm just telling you, just think about that, whether these topics are asked or not. Head trauma, shape of skull vertebra, muscle relaxant, capnography, pin index, Malampatti score, spinal anesthesia, pemphigus, vesicobullous disorder, scabies, alopecia, leprosy, torch infection, developmental milestone, genetic syndromes, pediatric surgery, like Meckels, Hirschsprung, CA cervix, management of third stage of labor, PPH management, endometriosis, STDs, contraception, ectopic pregnancy, medical disorder in pregnancy, abdominal trauma, cancer staging, thyroid nodule, chest trauma, vascular disease like PVD, brainstem syndrome, aortic dissection, pulmonary embolism, HIV, medical emergencies, and acute pancreatitis and all, DM, national program, biomedical waste management, SDG goals, various laws and acts related to health, ESI Act, PNDT Act, vaccines, imaging of paranasal sinuses, larynx, pharynx, otosclerosis, Meniere's disease, carcinoma larynx, cataract, glaucoma, retinal detachment, squint, retinal layers, IPC section, bone age, ballistics, poisoning, snake bite, immunology. I'm going to share the list. Neisseria, AFB, mycology, parasitology. I did not have a specific aspect in the micro. Anti-cancer drug, diabetic drug, diuretics, side effect of various drugs, neoplasia, RBC, WBCs, bleeding, transfusion. In biochemistry, vitamin, nucleic acid, enzymes. These are the specific areas. Last year, NEET PG paper was full of questions on vitamins, right? Heme synthesis, respiratory physiology, sleep cycle, ECG, cell membrane, arterial system, neuroanatomy, skull for those foramens, peripheral nerve injury. I feel that these are the top 100 topics that you have to make sure that you are not doing any of them wrong. तो एक्चुअली स्पीकिंग अगर 100 अगर कर लिए ना तो क्वालिफाई तो इससे ही हो गए. But the aim is not just the qualification, है ना? The aim is to perform to the best of our ability. And I believe that these are the minimum number of topics that you have to do. There is no limit to the maximum number of the topics. So these are the one. I'm going to share this list with all of you. Now let us talk about the challenge. The first is this. सर बहुत एंजाइटी हो रही है, बहुत स्ट्रेस हो रहा है, बहुत सेल्फ डाउट हो रहा है. तो देखो सेल्फ डाउट करने की तो जरूरत नहीं है. वी हैव प्रिपेयर्ड वेरी वेरी वेल. वी आर बाउंड टू गेट अ रैंक इन द एग्जाम. देयर इज नो डाउट अबाउट इट. थोड़ी बहुत एंजाइटी ना, वी ऑलवेज से कि सम अमाउंट ऑफ एंजाइटी इज ऑलवेज गुड, बट एक्सेस ऑफ एवरीथिंग इज बैड. तो अप टू दिस लेवल ऑफ एंजाइटी इज गुड. द मोमेंट इट गोज अबव दैट, है ना, तब थोड़ी एंजाइटी होगी तो बेटर होगा, बट ज्यादा होगी तो गिर जाओगे. तो टू मच ऑफ द एंजाइटी इज नॉट गुड. एंड डू यू नो व्हाई टू मच एंजाइटी कम्स? व्हेन यू कंपेयर कि यार वो तो ज्यादा पढ़ रहा है, अच्छा सोशल मीडिया पे ये देखा मैंने, ये नहीं देखा. तो अब क्या करना है? अपने आप को साइड में रख लेना है. ज्यादा लोगों से बात नहीं करनी, बहुत ज्यादा डिस्कशंस नहीं करने. वट एवर डिस्कशन दैट वी हैव डन, वी हैव ऑलरेडी डन इट. नाउ अब नहीं करने. थोड़े दिन एकदम, अगर एंजाइटी ज्यादा होती है, अगर एंजाइटी नहीं हो रही तो जो मर्जी करो. बट इफ यू थिंक दैट यू आर गेटिंग टू मच एंक्शियस, तो लाइक जैसे अरुणा इज सेइंग आई एम नॉट एंक्शियस, इसी बात से एंजाइटी हो रही है कि मैं एंक्शियस नहीं हूं, सब लोग एंक्शियस क्यों है. तो अच्छी बात है, बच्चे एंक्शियस नहीं होता ना. यू कैन डू वट एवर दैट यू वॉन्ट. But if you are getting too much anxiety comes with comparison. Anxiety comes with fear of result. अगर रैंक नहीं आई तो क्या होगा, अगर ये नहीं हुआ तो क्या होगा. एग्जाम ही तो है. लाइफ तो ऐसा थोड़े ना है कि आप बिना पैराशूट के कूद गए, उससे लाइफ नहीं जाने वाली. एट द एंड ऑफ द डे इट्स एन एग्जाम. एंड इफ यू गोना प्रिपेयर वेरी वेल, विच यू आर डूइंग इट, यू गोना परफॉर्म वेरी वेरी वेल. ठीक है ना. you remember that श्लोक of गीता है ना, कर्मण्यवाधिकारस्ते. what is in your hand is to work and don't think too much about the result, because what you are thinking is not gonna give you anything. But the way that you are reading, the way that you are utilizing your time is something that is gonna give you the rank. All right, so do not stress yourself. Please remember, at the end, ultimately it's an exam. It is not much. It's just an exam. It is not taking your life from you. Yes, it is a stressful exam. It is a stressful time. We are preparing very hard for the last few months, or not, maybe now I will say more than an year, but it's just an exam. All right, so this is absolutely okay. Do not go too much into the stress. More stress you're gonna take, you're gonna fall into the bad curve, and that is not needed. But if you are too much, please seclude yourself. Please do not talk too much about the exam with people. The more you're gonna talk, more anxious you're gonna become. And that is my simple point to you. Alright, so that's the remedy that I have. Another important point with this that the student have asked me is about sleep. Please remember, you should have a very sound sleep on the day of the exam, but in spite of your best effort, there are chances that you might not be having it. So please try to sleep adequately now. For the next 6 days, you have to take an adequate sleep, so that by any chance, if you are not able to get a good sleep on the day of the exam, which is very essential, I am telling you, you will still perform very well. You will not feel tired in the exam. But if you are already tired for the entire week and you could not sleep on the day of the exam, then that will be a challenge. And my grandfather used to tell me a very interesting story, and the story was, I studied whole night because finals were near. I went to bed, but my thinking was clear. I knew all the answers, my marks would be best, but I failed in the subject because I slept through the test. So that should not happen. You have prepared so very well, but because you are not in the best of the active stage during the day of the exam, and you spoiled it. So if you are thinking that you are getting anxious, you cannot control your anxiety, like me, I am also a very anxious person, then I will increase my sleep by 1 hour for the next 6 days. So that if I am compromising my sleep on the last day of the exam, I am still in the best of the active phase. And that is how I am gonna take care of it. And that is what I am gonna do. Right? Okay. Now, इम्पीरियम ज़्यादा नींद आ रही है ना, तो ठीक है, कोई टेंशन नहीं है. बट एग्जाम वाले दिन you have to make sure that you are having a sound sleep. How to reduce negative? This is a very big challenge. Please remember, at this stage, do not think about this word in your life. Remove this word from your life. Let us work on how to increase our positive. Now, for every positive, it compensates for 4 negative. If you think that you are not getting rank because of more negative, you are not getting rank because of less positive. So let us work on this, that how I can increase positive. Now in every set, let's say you are getting 25 correct. Then don't think that you will mark 30. You think that I am going to mark at least 37 to 38 questions in every set. Previously, if I am going to marking 35, now I am going to increase it to 37, 38. And with these 3 extra questions that I am attempting, I want at least one should be extra correct. So even that will give me +2. So that is where we have to focus upon. We are not thinking too much about reducing negative, but yes, there is one message that I want to give you is, you can reduce your negative by avoiding what? By avoiding silly mistakes. Now what are silly mistakes? You do not know some standard rules of the MCQ paper. What are the standard rules of the MCQ paper? The standard rules of the MCQ paper is age, gender, not accept. These are the 4 words that you have to see very carefully. Age, gender, not accept. You are not allowed to forget them. If it's a question which has got more than 2 lines, the first thing that you're going to read is the last line of the question, then 4 choices, and then the rest of the question. You will take less time to solve the question. The accuracy level of the question will be very high. Third, are you changing the answers? If it's a factual question, whatever answer that comes to your mind for the first time is usually the correct answer. So do not try to change too many answers of a factual question. However, if it's a conceptual question and after reading the question again, you found a new information in the question, and because of that you have changed it, then you can change that answer. Your accuracy level will be better. All these are ways to reduce your negative. But my idea is that I will think of increasing positive, not reducing just the negative. But yes, I have to avoid silly mistakes. I have to remember these certain rules of game. How to improve recalls? Sir, I have read it, but I am unable to recall it. And sir, for the last few days, it is happening that whatever that I have read, everything has gone for a toss. I am not able to recall. Do you know why? Because you have too much expectation from yourself. You are thinking that you will be able to recall everything that you have read in the last 1 year. You are able to recall everything that you have read in the last 5 years of MBBS. That cannot happen. You are a human being. You are not God. You will forget. This is the best gift that the God has given you, that you are forgetting. So this is absolutely okay. So what I am supposed to do is, in these last 7 days, what are the things that are more commonly asked in the exam that I am revising, and that I should not forget in the exam. Still you will forget few things, and this is absolutely okay. That means you are a normal human being. There is nothing else. So do not stress yourself too much if you are thinking that you are forgetting certain things. Now try to work on differences between two diseases. Whenever there are differences between two diseases, anorexia nervosa, bulimia nervosa, CMV, toxoplasmosis, myasthenia gravis, Lambert-Eaton syndrome, HSV, Japanese encephalitis. So these, whenever there are two diseases with some common feature, some differentiating feature, it's a standard part of an MCQ. Work on this phenomenon. Time management in the exam. I hope you have practiced the mock test that has been given. This mock test was not a test. It was basically to make you familiarize with the exam. The biggest challenge in this exam is that 40 question, 42 minutes. If you have done these questions in 34 minutes, you can't start the second set. You have to spend your 42 minutes in order to move to the next 40 set of question. Alright, so do not take your memory of this set number 1 to set number 2. Do not take that. It's a good idea to take deep breaths for 30 seconds minimum between the two sets. So that means you do not have 42 minutes, you have only 41 minutes, or maybe slightly less than that, or maybe slightly more than that. But before you are moving to the next set, you are taking deep breaths, सांसें ले रहे हो, so that the memory, either good or bad, of the set 1 are not affecting the set 2. And try that you are attempting at least 37 to 38 questions out of 40 in each set. And that is what I will suggest. Alright. Overthinking, ये भी एक बहुत very big challenge. Sir, I have read a question, I have read 4 choices, and then I know that answer is B, but I thought that there is some trick that has been given in the question, and because of which I have done a lateral thinking and I picked up an answer, which is wrong. So NEET paper is usually a straightforward paper. The number of trick questions in the NEET PG are there, but the number are much less than the straightforward question. So don't do too much of the overthinking in the NEET paper. Usually the questions are straightforward, the choices are straightforward, unless you are missing an information that is given in the question. And let me give you a very simple example. What is an overthinking? Overthinking is, let me give you a question, and probably that can give you the best way that what is the meaning of the overthinking. Okay, let me give you a question. The question is let me put it, maximum radiation exposure is seen in. Okay, maximum radiation exposure is seen in option 1 chest x-ray, option 2 MRI, option C CT chest, and option D IVP. Maximum radiation exposure is seen in out of these 4 investigations. Anybody who can give me the answer? I am trying to tell you what is called as an overthinking. Maximum radiation exposure is seen in, what is your answer? Chest x-ray, MRI, CT chest, and IVP. What do you think is the answer? And answer is CT chest. A straightforward question. No challenge. A very straightforward question. Okay. So I assume that everybody is gonna give me the correct answer for this particular question. So that is not what I wanted to ask you. Okay, but can I say that you have picked it up? Okay, now let me change it. Now let me give you a different question. Okay, now let me give you a question. Least radiation exposure is seen in A, B, C, D. Least radiation exposure is seen in A, B, C, D. Tell me, what do you think is the answer? Least radiation exposure is seen in overthinking kills you in the exam significantly. Least radiation exposure is seen in, what do you think should be the answer? Okay, answer is B. Answer is B, MRI. The amount of radiation in a chest X-ray is 0.02 millisievert. The amount of radiation in MRI is 0. Amount of radiation in a CT chest is 8 millisievert, and amount of radiation in an IVP is 2.5 millisievert. Now what is called as overthinking? Overthinking का मतलब होता है least radiation exposure is seen in. अच्छा, यानी कि एग्जामिनर पूछ रहा है, एग्जामिनर इज आस्किंग दैट देयर इज अ रेडिएशन एंड इट इज लीस्ट. एमआरआई में तो है ही नहीं, तो रेडिएशन होना भी चाहिए और कम भी होना चाहिए. देयर शुड बी अ रेडिएशन एंड इट शुड बी लेस. तो इज इट एमआरआई और इज इट अ चेस्ट एक्सरे? एंड देन यू आर मार्किंग इट एज अ चेस्ट एक्सरे. दिस इज व्हाट इज कॉल्ड एज ओवर थिंकिंग. ऑलराइट, सो दिस वाज नॉट अ ट्रिक क्वेश्चन. It was not a trick question, it was a straightforward question. So trick question is a different questions, overthinking is a different thing. So this is what is called as overthinking. Overthinking should be avoided in the paper. है ना? Overthinking should be avoided in the paper. Now what are trick questions? Now trick questions are very simple. Trick questions are investigation of choice to diagnose acute subarachnoid hemorrhage. Investigation of choice to diagnose acute subarachnoid hemorrhage. What do you think is the answer? It's a straightforward question. Answer is NCCT. Acute hemorrhage in the brain. It is best seen on a non-contrast CT. Now what is a trick question? A trick question is investigation of choice in a diagnosed case of acute SAH. Investigation of choice in a diagnosed case of acute SAH. Now the answer is, now the question is that SAH has already been diagnosed, right? Now you have to know what has led to the subarachnoid hemorrhage, and then you're thinking, okay, rupture of aneurysm leads to subarachnoid hemorrhage, and then I need to perform an angiography. So this is a trick question. So there is a difference between overthinking and solving a trick question. If you read a question properly, you will be able to understand that whether it's a trick question or whether it is not a trick question. So this was not a trick question. It was a simple, if you mark it as a chest x-ray, it is an overthinking. It's an overthinking. But this is a trick question, and this is a 50 to 80% category question, which is a rank differentiating question. Right? Third, do not stress yourself too much if there are certain questions that you are unable to solve. That's the last point in this session. Fear of missing out. बच्चे 200 क्वेश्चंस आएंगे पेपर में, even if you are aiming for rank 1 in the exam, है ना? That is an upper limit that you are aiming for this particular paper. Even if you are aiming for rank 1 in the exam, there will be 10 questions in the paper that you will not be able to solve. This is absolutely okay. This is not a NEET UG exam that is gonna happen and that you will be getting 800 out of 800 or 720 out of 720. Okay, it will be a complete surprise for me if somebody is getting 800 out of 800. So this, I have never seen it in the history of a NEET PG exam. So there will be around 10 questions in the paper that you will not know. There will be around 1 or 2 silly mistakes that you will be doing in the paper. This is absolutely human. This is absolutely normal. Don't bother much about it. So at this stage, do not let this word come to your mind ki, oh my God, I have not read this. Oh my God, I have not read this. If it's a very, very frequently asked topic, you all have those lists available to all of you. I am not loading you with that, but do that. Otherwise, follow this. Please remember, you are prepared pretty well for the last 1.5 years. We are also waiting for all of you to perform to the best of your ability. I am only telling you, I am not looking at that you are getting rank 1 or 2. I am only looking at one thing from you, that after the exam, you can say this to us, that sir, we did our best. And whatever that you have got after you did your best, we are happy with that. We are absolutely happy if you did your best. And that is what I am looking for in after the exam from all of you. We are eagerly waiting for all of you so that you can reach to the highest of your potential that you are looking for. And that's all that I'm gonna say about these last 7 days. That's all, guys. If you have any doubt, anything that you have any doubt, let me know, that I'm gonna try to answer this. Alright. Yes, thank you Arita for this. People are saying that they will be shoot up in the rank this year, so really stressed. Nahi hoga, same rehna hai. And think about, chalo hoga shoot up. Do you think you can control it? You cannot. What you can control? That you can read very, very well in the last 1 week. So let us focus on the things that we can control. Let us not think about the things that we cannot control. That's all. Concentration during exam fails. शिव बहुत इंपॉर्टेंट बात बोल रहा है बच्चे. तो मैंने क्या बोला, अभी तो कंसंट्रेशन सिर्फ 42 मिनट्स के लिए मेंटेन करनी है, तो 41 मिनट मेंटेन करो और 1 मिनट टेक डीप ब्रेथ्स, so that it gives your brain a time to concentrate again for the next 41 minutes. इसीलिए वो बोला ना 42, 42, 41, 1, 41, 1, right? Paper will be tough due to delay. I do not think so. Over a period of time, the papers are getting towards the easier side. But the rule is very simple. The rule is any topic that is asked in the exam repeatedly, the level of difficulty of that topic increases. Any topic that is asked for the first time, it is usually asked in a very, very superficial manner. That is the simplest philosophy. Sir, can we solve one paper of FMG just in the morning if not done? अच्छा, एक और भी बात है. Please remember, lot of time people will tell you कि नहीं रात को 8 बजे ही सो जाना है. ऐसा नहीं होता. हर स्टूडेंट अलग होता है. Do that the way that you want it, but now manage your sleep well, so that if you are unable to sleep very well for the last day, it is compensated right now. कितनी बार होता है कि हम रात को पूरी पार्टी करते हैं और उसके बाद अगले दिन भी we are active and we get tired towards the evening of that particular day. That has already been compensated, so this is absolutely okay. I remember my very, very close friend studied till 5 a.m. the day before the AIMS exam, and I slept at 8 o'clock. And he got rank 18 in the exam. And he said कि पेपर देख के सब नींद भाग जाती है, तो ऐसा होता है. But you should not be too much tired on the day of the exam. That's a simple philosophy. I believe that you should not spend too much time in watching videos at this stage in the last week. Most of the reading should be from the notes. The screen time should be less in this particular time. That gives you more tiredness. So whatever screen time that you have done, right now the screen time should be to relax, and to relax, and a half an hour to 45 minutes to 1 hour of relaxation screen time is still acceptable. It is still acceptable. Too much of watching the videos should not be done in this particular time. It's more of reading from the notes that should be done at this time. Should we go back and review the answers? I believe that you are not doing too much of the MCQs and you are spending more of the time in reading the theory or revising the theory at this time. How to read medicine? I believe that the topics that have been asked in the last 5 years, that the one that you should do. If you have an access of, as I told you, this is the order. If you have the 20th notebook where a consolidated medicine, I have given one complete day to revise it. If you have annotated TND notes, then revise it from that. If you have one shot plus Y program, then that will be very, very useful for you. If you do not have any of these three, then you have any short program, then try to use that to revise your medicine, and that is how. Or Revision Express is also a very, very good way to revise medicine. Taking a drug before the exam, you can do that. I did it, but I will say that there is no harm in talking to a psychiatrist before doing it. And there is no harm. You can always do that because sometimes every person react differently to a drug. That's how it is. I did it when I was appearing for the AI All India exam during my time. हिमाप्रिय, हाउ टू अवॉइड नेगेटिव थॉट्स, है ना. अपर लिमिट क्या होगी एग्जाम के बाद, सोच के देखो ना. बट अगेन एज आई एम टेलिंग यू ना, प्लीज थिंक इन दिस मैनर. आई एम टेलिंग यू नेगेटिव थॉट्स विल गो. दिस इज दैट एट 8:49 नेक्स्ट संडे you will be free from this trauma. So just 1 week that is left. You will be absolutely free from this particular trauma. So let take care of this 1 week. All right, chalo. So that's all, guys, that I wanted to do. I am eagerly waiting for all of you so that you can say this after the exam that you did your best. Ideally this should have been done 6 months before. Exam got postponed, but now finally we are towards the fag end, and I am very, very hopeful. I believe in the God, and I have prayed for you. Please remember that if you think that you do not know the paper, remember that there is somebody who is praying for you. Somebody who is praying for you. Your parents are praying for you. Your friends are praying for you. Your teachers are praying for you. I am praying for you that you gonna get the result that you are looking for. May God bless you all, and wish you the bestest of the luck that you can get in the exam. All right. Take care, and God bless you all.